Hello. So from the beginning of the semester to now, my initial advanced directive slightly changed. I changed it to be more relatable and realistic to my life. And the only change I made was that I want to be at home instead of a hospital if I'm dying. And then also, I used to have my future husband as part of it, but I want it to be more realistic, so I changed it to my best friend, Itzal Barboza. And then what influenced this is that I realized that death isn't just like an old people thing, and it can really happen to anyone, so I have to be ready to accept that. I just made it a little bit more relatable to life, but it's still true to who I am. So taking this course has influenced the way I see death, because I feel like before I would see death as something really sad, especially in a hospital, but I realized that people who die in a hospital do have the chance to have a nice and like calm death, and it doesn't have to be this whole traumatic thing. So yeah. My understanding of the nurse's role in death and dying changed over the course of the semester, because in the beginning I used to think that like nursing was just kind of like you bagged up the body and you sent it to the morgue. I didn't think there was like more behind it, but after taking this course I realized that like the nurse really influences how the patient lives their last days, and that can be either negative or positive, but also they influence the way the family handles with grief. And like, yeah, nursing is just very influential when it comes to death, and I think that this course has helped me to become a better nurse. And hopefully if I experience death with one of my patients, I will come back to this course and use the things that I've learned. And if I were dying, what I would expect from a nurse is kindness, of course, but also just empathy for my family, because I feel like it's harder for the family than the actual patient. So yeah, this course has taught me a lot. Thank you.